And today, first we're gonna go over blade handles. You don't have to record this if you don't want to.
Is it okay?
Oh, you want to?
Yeah.
Okay. All right.
You're a star.
Yeah. So, couple things to know about the blade handles. We know this is 3-handle, 7-handle, 3 long. Okay. Couple characteristics about the blade we want to know is see the angle here. That's important. These grooves that are on the side. That's important, and this little lip that's right there, okay? If you notice when we turn it over, there's none of that, so you can't put the blade on the wrong side. I mean, you can, but it won't stay, okay? All right, our blades, most of the time they'll come in a package, sort of like your suture packet, like this. Actually, they'll come in a package like this. So you open it to your field, okay? When you open your own blades, you want to put them somewhere where you know where they are, okay? If someone else opens your room, a lot of times they just pile your shit in the middle of your table. So your blades could be anywhere, you know what I'm saying? So when you're going through your stuff, if you didn't open it yourself, be careful when you're digging through your stuff that you don't cut yourself on the blade. A good circulator or a person who is opening your blades to you on the field, they'll know to put your blades on the right front corner, so you know where they are, okay? Couple different ways we could take blades out of the sharps box. Here, they'll always be in the sharps box, and if we need to open new ones, we'll open them to you guys. The circulator will, but majority of the time they'll be in your sharps box. Your hypos, your needles, and your blades will be in your sharps box. One way you can get them out, this is the way I get mine out. If you put your needle driver straight up and down, it's not hard to take them out. You can take them out like that. This is a magnet in the bottom, so they'll stick. If you turn it upside down, give it a couple of taps on it, they'll fall out. Okay, so you can do it either way. Never ever do I want to see you with your fingers in this sharps box. Okay, if you put your same fingers in the sharps box, I will yell. Okay, just a safety hazard. And like these blades and needles aren't dirty as far as body fluid and stuff, but they're dirty as far as being in the lab and that kind of stuff. So you really don't want to get cut or stuck with this. You get a bad staph infection or something. Okay. Now blades, 2 different blades here that we're going to use. We actually use 3 blades throughout our time here. The majority, we're going to use a 10 blade, a 15 blade. Now, on these blades, if you notice, there is a 10 right there. Okay, you can barely see it, but it's there. And there's a 15 on a 15 blade. But we don't want to have to take time to read what the blade is. So we want to make sure we learn what they look like. Okay, 10 blade always has that fatter diameter. We use it for skin mostly. Very seldom will we use a 10 blade for anything else except skin. Okay, our 15 blade you can see is a little skinnier. This is actually the cutting side right here, just a little edge right here. That's the side that's sharp. Okay, what we're going to use this 15 blade for most of the time is if we want to poke a hole in the peritoneum to get our scissors in to open up the peritoneum, or if we're doing something like a laparoscopic procedure to make holes for our trocar, is usually what we'll use a 15 blade for. A lot of the blades are interchangeable with blade handles. Some blades are specific to blade handles, okay? One of the ones that I know is the 21 blade, which is a C-section blade, will go on a 4 handle, but it won't fit some other ones, okay? In here, you can put a 10 blade on the 7 handle, but we're not going to do that here. Your 10 blade is for your 3 long or your 3, okay? And your 15 is going to go on your 7 handle, okay? Some of the characteristics about the blade. If you notice, there's an opening right here, and then the opening gets smaller. Where we're going to put those grooves in there first, and we're going to slide these edges into that groove that I showed you on the needle driver, okay? And if you notice, the angle of the bottom of the blade is going to match the angle of the handle. If it's on backwards, it's going to look like that. You can put this on backwards. The only thing is it's hard to get off, okay, really hard. So make sure you're watching your angle when you're putting your blade on, okay? Now, once we get are ready to put our blades on, I will usually take my blade, because we're sterile at this point, and I'll put it up against my stomach just so I can alleviate some of the natural tremor that I have, and to give me some support. Okay, it's better than holding it out here and Okay, when we pick these blades up, if you kind of push down on the sharps pad, it has a little give because it's spongy. It'll be easier to scoop it up. Okay, when you do pick it up, we don't want to keep it out here like this, because then we don't have much leverage. So if you just bring this in like that, and we don't want to cover up this hole because that's where a knife handle has to go. Okay. Now, the key to this is having the blade straight with your needle driver. Okay. If it's angled a little bit in any way, it's going to get stuck and it's going to be hard to pull on. If at any time it's hard like that, stop, take it off, and then retry it. Okay. Our knife handles are a little bit worn, so they go on a little bit easier than normal. But still, if you have a new blade, a new handle, it may be a little bit harder. You might have to use a little bit of force, but you're not shaking, or you know what I mean, to get it on. So once you have it straight, you're gonna put that in there and just pull back. Okay? And then you can see right here that it's clipped on right there. It's a little shaky because, like I said, our blade handles are worn, but that's on there. Okay, and you'll hear a little click once you get it on. Sometimes you'll hear a little click if the blade's tight. To check it, just flip it over and tap it a little bit. If it doesn't fall off, you should be good. Okay, now when we take this off, you want to flip it to the back side. Okay, there's this little corner right here. We want to grab that. Now, we only want to pull this corner down enough to get it over that little lip right there. Okay, so we don't need to pull it down a lot. If you pull down too much, it bends the blade where the aperture is, and then it's going to cause it to stick. Okay, so we just need to grab the corner. Always keep your knife pointing towards your sharps pad, especially when you're taking it off. Grab the corner, pull it down, and push forward. Okay. Now the 15 blade, same thing, a little more challenging because it's tinier, but same concept. With your 7 blade and your 3 long, you can choke up on it. You don't have to hold it from way back here, because then once again, you get that natural tremor and it's harder. So go ahead and choke up on it a little bit. Don't be afraid of the blade. We want to be cautious and aware, but not afraid, okay? So same thing, we're gonna pick this up, make sure we don't cover the hole, and go down, just like that, okay? Click, we'll flip it over. Now this one, it has a little bit smaller edge to grab a hold of. Same thing though, pull down, push forward, okay? If at any time it's harder than that, try to readjust how you're holding your blade and your needle and your blade handle, okay? Because it might be just a little bit crooked, and if it's just a little bit crooked, it won't line up with those grooves, and that's what'll make it get stuck, okay?
Okay.
All right, so that's blades. Once we are done with our blades, take them and put them back into our sharp pad, okay? Next, we're gonna do hypos. The way we get these out, same thing as anything. Use our needle driver, okay? Here's our syringe. We have a 10 cc syringe. The majority of the time, we'll always use a controlled syringe for local. The docs like the little finger holes, and so we'll use a controlled syringe. This is a 10 cc syringe. Some of my numbers are coming off right there, but we'll get you guys will have new ones for practicing the testing stuff. 10 cc syringe. Couple things to know about our hypos here. Okay, that's going to be your drawing hypo. See how big that needle is? That is a 19 gauge needle. The way needle diameter works is the higher the number, the smaller the gauge. Lower the number, the bigger the gauge. This is a 19 gauge. 18, 17 gauge they're usually used for to give blood, plasma, something like that. So it's a pretty thick needle, okay? That's what we're gonna use to draw our medications. Once we have drawn our medications, we will put our injection hypo on, which is a 25 gauge needle. This is what we're gonna use to inject, okay, to the patient. Okay, there is a couple different ways that you can recap these hypos. Two ways that are allowed. One, you can take it, slide your hypo in, push it down like that. The second way you can do it is you can scoop. Put your hypo in, scoop it up. When you push from the hub down here, okay? Not from the top. There's been instances where people push from the top or slap it from the top. This splits, needle goes straight through their hand. Okay, so make sure always from the hub when you're putting it on, or you can put it on like that. Myself, personally, I do it like that. Okay, so once we get that, next we have our vial. Have different sizes of vials. This is a 50 milliliter vial. We have 20, 10. Majority of the time we'll use 20, okay, for our procedures that we're using. A few things that we need to know about our vial is the strength of it, what it is, and the date, okay? So 0.9% sodium chloride, expiration 1 February 2015. That is outdated, okay? What we usually do is when you guys start doing your procedure and stuff, we'll cover this label with a new label. It'll say lidocaine, bupivacaine, Marcaine, one of those, and it'll have a correct date on here. And it could be usually a couple years out, okay? If at any time you guys are reading medication to each other and it doesn't have a label and the date is wrong, act as so it is, okay? Hey, this medication is expired. I would not use it, and then we'll have you guys write in a new date, or we'll write in a new date, but we'll change the date to make it correct. But we do want to leave some of these like this so that you can get in the habit of getting rid of outdated or bad medication, okay?
Okay.
When you get it, you're sterile, you're at your field, you're gonna draw your medications from your circulator, so your circulator is gonna come and you guys are gonna do what you call verify. So your circulator is gonna say, I have 0.9% sodium chloride, expiration 1 February 2020. Once he or she says that, you're gonna read it back. 0.9% sodium chloride, expiration 1 February 2020. Now we both verified it, it's good to use. We both realized it is not expired. So if you hold that, okay, we're gonna take our cap off and we're gonna grab 2 cc's of air from the tip of the plunger. Okay, not from the sides, but from the tip. Okay, go ahead and hold that upside down for me. If you are, hold it a little higher. Okay, if you are the person drawing medications, I want you to hold your syringe and, with 2 hands. Either it's this or your syringe. You're gonna put it in. You're gonna push that 2 cc's of air in. It breaks the seal, which makes it easy to come out. If I was to just put this in there and draw before we broke the seal on the medication, when I pulled down on the syringe, it would suck back up in there, okay? So we pushed that first 2 cc's of air in there to break the seal, to make it easier to draw. Okay, once we get our first 10, like I said, we have a 20 cc syringe and only a 10 cc syringe and 20 cc vial. We're gonna take 10, put it into our med cup. Second time, you don't have to draw air, okay? We already broke the seal on the first time. Draw up our second. Get our air out. Okay, and this 10 cc's will stay in your syringe, okay? Recap your drawing hypo, take that one off, and we're gonna put on our injection hypo. Now, the last thing we need to do with this medication, and most important, can you guess?
With this, or
With this medication, with our medication that we just drawn up.
check it again?
Oh, checking the temperature or something?
Nope.
No?
So, label.
Oh, okay.
Okay, whenever we get medications or even from anything from saline to sterile water, we're gonna label it. That's the first thing we do, because the last thing we wanna do is have a bunch of cups like this on the table and we don't know what's in it, okay? There has been instances where techs have done that, ended up injecting the wrong stuff into the patient, and it was bad, okay? So we always wanna label our medications right after we draw them. If we are intra-op and the doc asks for local, they will wait for us to draw and label our medication. Yes, they might give you a few huffs and puffs, but they're not gonna rush you because they know how important labeling the medication is, okay? So before you do anything else, after you draw your medication, label. And we will label the syringe and the med cup. So it would be 0.9% sodium chloride on here, 0.9% sodium chloride on there. In your back table pack, you seen the marker? When you get to the hernia procedure, you will have a marker and labels that come in your pack. And that's what you'll use to label this. Make sure you don't put your label over the top of your numbers because you're gonna need to see those later. And then also, we never pre-label. So if you know that you're gonna get 1% lidocaine with epi, but still you can't pre-label that label because then it might change. You know what I mean? So no pre-labeling. We do have pre-made labels out there in industry. They are pre-labeled. They say pretty much a bunch of different medications that we would use. Some we have to write in because they're mixtures of things, but for the most part, they do have those. Still, we don't want to pre-label our medications we actually do, okay? When we are doing turnover, and we are gonna refill our vials, use the drawing hypo. Always make sure you have a flat surface and one hand on your on your vial. Go ahead and put this back in. Go ahead and draw the rest out of here. And also, if you're intra-op and you need to get your other 10 cc's of local, you can draw that up with this small one on. It's just that we don't put it in the vial with the small one because it'll bend it, okay? But you can draw out your med cup with that one. And then we're gonna just take that off. Now, make sure these are getting filled during turnover, because if you come for your test and there's not 20 cc's in here, you just get points off because we don't have enough local, okay? So make sure when you guys are doing turnover that this gets refilled, at least to this edge right here, okay? Just so that we have enough come test time, right? All right, thirdly, we have suture. Sutures can be hard, but also can be pretty easy. Okay, suture packet right here. This is what it comes in. Okay, this is not sterile, but everything that you need to know about this suture is right here on the cover. It's a PS2 needle. It's 19 millimeters long. That's how long the suture is. It's a reverse cutting needle, and the diameter of the suture is a 3/0. Okay, now when we open this up to get the sterile part out, look at there, same information on there. Okay, this is the part we keep on our sharps pad. I usually keep my top paper like this on my sharps pad or close to where this needle is, because sometimes the doctor could be suturing with a 3/0 and he says, hey, give me a 2/0. So you give him a 2/0, but he wasn't done with this. We still need to know where that 3/0 is and which one the 3/0. So if you keep this package and keep it close to your suture, and you'll know what it is. Doctors are, I think is really cool how they can tell the diameter of the suture without even looking at the package. So they know if you gave them a 2/0 or a 3/0. So for us to keep track of it, I keep my paper with me. Even if I don't keep it on my sharps pad, I might have them lined up from top to bottom or whatever, just so I can know which suture is which. Okay, so your suture packet can do a lot for you. All right, I'm gonna show you this on a bigger needle. Okay, see how it's flat right here, but it starts to round out up there? Mm-hmm. Okay, so this right here, the round part is the swedge. When we go to load our suture, we don't want to clamp our needle driver on the round part because that's where the suture is connected to the needle. And if we clamp down on that, it's going to crimp that the round part, and the suture will get loose. So we want to be right in front of that. Two ways we can load this needle, and it sits in there the same way it sits on your package. So it's in there like a smiley face, and it's the same size as the one on the package. Okay, two ways we can load this. One, you can set